The night before the podcast, I told my father, who's also a laparoscopic surgeon, that the next guest on Delhi Docs is Dr. Pradeep Chowbey, a Padma Shri surgeon. And you know what my father said? हमें भी तो लेप्रोस्कोपी डॉक्टर चौबे ने ही सिखाई है. And that hit me hard because here's a man who changed the thought process of an entire generation of surgeons. And the patient starts walking the next day. So imagine you are hearing from a guest who brought laparoscopy to India and then trained thousands and thousands of surgeons. So Padma Shri, world records, operating on President of India, I think these are very small compared to the legacy he has built. So now let's welcome Dr. Pradeep Chowbey and ask him the right questions.
A lot of people just write US, UK, and so many things.
Going abroad and training yourself was maybe 30, 40 years, 50 years back.
Are you the person who believes in work life balance?
Hyped to the extent of laziness.
Should doctors be on social media?
You are less confident, then you do all these sort of things.
Hands on training during residency.
Everybody feels that operating is hands on training. It's not true.
कोई भी young surgeon जो देख रहा है उसको कैसे मिलेगा पद्मश्री? So you are the face of laparoscopic surgeries in India. You started them when no one was doing it in India. So sir, take us to the moment when you introduced it. Was it easy introducing it? Did you face some challenges? Who were your supporters? Who were your critics? Take us to that time.
Yeah, I think it's a very interesting incidence. I was attending the American College of Surgeons meeting in New Orleans, USA, and Reddick and Olson, two surgeons, presented 4 cases of that time what was called as a videoscopic cholecystectomy, and first of all we could not understand. This is 89, and then they showed how these patients are walking in the same evening of operation with a smile on their face. So I thought it's a big shock, because we used to see our patients having pain and problems and issues which used to continue for a couple of days in the post-operative period. And suddenly I thought that if it is a way forward, I thought this is the best way we can operate and make the patients comfortable even after the operation. So that was my exposure, and then I thought maybe this is the type of surgery which I should look into.
Okay.
And not realizing that the equipments were very expensive at that time, the camera and all the systems. But I thought, let me give it a try. And that's how we started in early 90s in India.
Sir, who bore this cost in the initial days? Was it transferred to the patients or the hospital managed the cost? Like, how did you promote it? Because if you are offering this surgery to a patient, he can get it done in the open way, in a cheaper environment also. So what happened with that?
Capital intensive surgery. So, for example, I was in Gangaram at that time, and the hospital did not buy this equipment.
Acha.
So they said ki buying such an expensive equipment for a common surgery and having a disposable cost of disposable things,
Right.
So Gangaram did not buy it, and
Okay.
so much so that I had to buy my own equipment that time, which
Okay.
used to be very expensive, and they were all imported from the Western world. Gangaram refused to buy, but somehow I was insistent, and I felt that this is the way forward. So I took the chance and the risk of buying the equipment myself. And those days, in fact, surprisingly, there were no extra cost for these surgeries.
Okay.
They were little expensive,
Right.
but there was no
Extra cost.
added to the surgery. But the biggest resistance was from the surgeons, because they were at the comfort zone and they did not want to get into that learning curve of laparoscopic surgery.
Right. Then, sir, us time so there was no social media or anything. How did you publicize it? How did you teach or promote it?
So there was that time only there was a patient to patient thing, you know. There was a news, if you recollect, there was a news reel in NDTV at that time, The World This Week. And Mr. Nandi showed in that a very short clip of video cholecystectomy and video appendectomy, and that must be in the early 90s. But that became very popular, you know. And when I started, it was covered by the national news, the new method of operating. So maybe I would say it was a very slow patient to patient, but there was a big force because patients were comfortable, their pain was less, the cosmetic outcomes were excellent, and they used to go, they thought that they can go back to work within a couple of days after operation. Otherwise, it used to be 6 weeks to 3 months before they could go back to the normal activity. So I think it was a patient force, and patient made it so popular, far more, I would say, appreciable than even the media today. Because we have doubts about the social media.
Exactly. It could be fake. It
could be fake.
Yes, definitely.
But those days, the written articles and the television, this thing, though there was only Doordarshan,
national.
but still we could get good mileage out of it.
And sir, now you are promoting and using robotic surgeries. Sir, is it easier now to promote it because you're senior? That's why, or tell me about it, sir.
No, I think you see, we belong to a generation of surgeons who have seen the conventional surgery also, you know. So for 10, 15 years, we were doing conventional surgery. Then came the laparoscopy. So the difference was that conventional surgery is the three-dimensional surgery, and laparoscopic surgery is two-dimensional.
Two-dimensional, right.
So we lost one dimension. But as a surgeon, we adopted ourselves and converted ourselves from 3 dimension to 2 dimensions. That was a big setback from the surgical point of view. But with the magnification and you know, excellence in that, we realized that this is the way forward. So then came robotic surgery, quite some time back now. Is again a standard way of operating laparoscopy. So we call it a robotic laparoscopy or robotic assisted laparoscopy, moving on from the conventional laparoscopy. So now the laparoscopy has become conventional and robotic has been the state of art surgery.
And it has added the one dimension.
And it has added the one dimension which we lost almost 35 years back. So that, of course, makes the surgeon more comfortable because they can finish the operations quickly. Though the port size and everything remains the same, but still I think surgeons are more comfortable. They are sitting in the chair, they are operating, and they are getting three-dimensional views. So there is a depth perception which adds to our surgical skills. And with artificial intelligence, machine learning, and dexterity of the surgeon has multiplied, you know. And a simple example is that the previous car which we used to drive never had anything, you know, it was just clutch and accelerator and brake, you know. Now you have got so many gadgets working for driver, you know, and it has become so easy now. Driving, automation, automatic driving, in a lot of sensors to tell you the
parking space, the cars around you, yes, everything. It's
so
great.
That's how the difference is between laparoscopy and the robotic surgery. So as a surgeon, I feel that we have become far more accurate, far more safe as compared to what we were as a laparoscopic surgeon. And that's the way forward. And at the moment, the cost of the robotic system is expensive. It's almost about 12 to 15 crores per system. But I'm sure the cost will come down
over the period
over
of
a
time.
period of time, like cell phone. which used to be so expensive, and now you see that everybody is using the cell phone. So I feel the same way. I think robotic laparoscopy will replace the conventional, so-called conventional laparoscopy in times to come.
Great. Sir, when I compare this to your training, sir, in your training you must have done open, as you said, conventional.
yeah.
Then you moved to laparoscopy. Then you moved to robotic. So, sir, whatever you learned in your training, was it a waste? Did that affect your any way in your career? Sir, I want to know this because वो अलग चीज थी. Now you are doing something completely opposite. Sir, what's your
No,
take on it?
I wouldn't say that we are doing it opposite. I would say we are doing it the same. But the technique has changed, technology has changed, and understanding has changed of that same subject. That is important. Because those days there will be hardly any diagnostic. Ultrasound came very long time. There was only the clinical examination. And then ultrasound came after very, very long time. The first CT scan of head came in 77. So the technology really changed the medical science, Look at the investigations. Previously, there is very few investigations. When we used to get a thyroid investigation, it used to go to Bhabha at Mumbai for a simple thyroid estimation, which used to take more than 3 weeks for a diagnosis to come, the estimate to come. So those things have changed. But I think clinical presentation remains the same. The way you handle a clinical situation remains the same. So-called surgery also remains the same. If you are repairing a hernia, you are still repairing a hernia. But say, for example, when we talk about hernia, the mesh were, in today's context, they were quite primitive meshes. Now we have got a lot of advanced high generation meshes, multiple layers of meshes we are using for hernia, which were not available in the past. So those things have changed. But still, I would say our aim remains that the patient should get all the benefit of technological improvement and also the benefit of the expertise of the surgeon and the surgical team.
Sir, one of the most common questions I get asked, or I think you must also have been asked this question, hands-on training during residency. How important do you think it is? Because a lot of residents are dissatisfied with the particular institute. They don't get enough hands-on training. What's your take on it?
See, I think hands-on training is not when you are operating. That is just a small fraction of hands-on training. Right. The hands-on training is when the patient comes to attend the OPD. What are the symptoms? What are the questions? What are the investigations which you like to ask? How much detail you would like to know, or how briefly you would like to know about that? That again is a hands-on training. So suppose you see 30-40 cases in OPD every day. You are going to get a great hands-on. So this is a part of hands-on training. Unfortunately, in surgical field, everybody feels that operating is a hands-on training. It's not true. It's maybe, I would say, operating may be just about 10% of the so-called hands-on training.
It comes with time.
It comes with time, and if you have covered 90% of the things, starting from the moment the patient walks into your OPD, what investigation needs to be done, how the patient has to be prepared for anesthesia, how the patient has to be prepared for surgery. And then comes surgery, and then again there is a long list.
Rehab period. Complete.
Rehab period, pain management, the wounds management, how to handle the complications. So what I mean is that we should not consider hands-on training only while on the cutting side, that's not really important. Because if you have trained yourself into 90% other things, actual cutting doesn't take much time. Right. It doesn't take much time.
And sir, what do you think are the strengths of Indian surgical training and the shortcomings of Indian surgical training these days?
Well, I think, of course, with the passage of time, uh, the passion for training and teaching amongst the teaching faculties are reducing because of various factors. It is not their intention, but the intentions of the trainee as well. So training and teaching is, it's a two sides of coin. One side is your teacher, and the other side of the coin is the trainee, the student. And both the coins side has to be strong. You can't expect the teacher to be training a student who himself or herself
Is not
may not
willing.
be as keen as the teacher. So over a
Right.
period of time, they lose also interest. So I think in the previous time it was, if you really look at Indian training, look at the Gurukul training. The training used to be from morning you get up till night when you sleep. That was a
Right.
training. It was not only Shastra which you were taught. The way of life, the looking at the things, situations, those were very important.
Right.
The same way, I feel that the training standards might be less than expected
Okay.
because of both the sides of the coin.
Sir, on the same note, do you think that every surgeon after his training should move abroad for a while at least to learn the skills which probably missed out here?
No, I think it's the other way around. We strongly feel that that concept of going abroad and training yourself was maybe 30, 40 years, 50 years back. That concept now, India has got the wonderful teams of surgeons, great hospitals, the technological advancements. Many times I say the Indian hospitals get the technique and the technology much before than the Western hospitals, because of the enthusiasm, the opened up policies of the government, import facilities, bank loans, etc., which were not there. So now I feel it's the other way around. Now we see that lot of trainees are coming to us for training themselves into this
From abroad
from
also?
abroad, because
Okay.
they don't see those numbers, they don't see that passion in the professionals, because many times you will see in abroad they are definitely hard working, but there is a limitation. They want a particular hours, they want a weekend, they want vacations, they want holidays, which by and large in Indian system and Indian families, it's not a very particular thing that after 5 o'clock you will not work. There are no hours of training, for us. There's no weekend, there's no morning, there's no evening. If it's demands, even at, say, for example, maybe even now I work for 12 hours, 15 hours a day. So because it is needed, it's demanded. It's not that you look at the watch.
But sir, are you the person who believes in work-life balance, or at least for the resident, or do you think a resident should put in like 80 hours a week for the training?
See, I think in the Western world life, work-life balance has been hyped to the extent of laziness.
True.
Right.
Hanji sir.
So, that may be true with certain subjects, but in medical field, I feel that it may or it may not be correct way of looking at. You can't leave the patient midway, and you have to make sure. I mean, you can shut down your PC and a computer and go back home, but same thing you can't do with the patient or the operation table or operation theater or with the patients. You have to reach to a conclusion. So even if you have asked for an investigation, you should know the result of that investigation before you walk out. For that, you might have to wait and see the result and then manage the patient accordingly.
And not just the patients, are sometimes even operating room, the technician calls, there is some problem with the
Yeah,
table
yeah.
or some system, then you have to handle it before 6 a.m. sometimes.
Yeah.
Sir, do you have some message for a young surgery resident who's probably watching this at, let's say, 2 a.m. in the morning after a very hard, long shift and is feeling bad about his possible career choice? What do you have to say to this?
No, I think it's important for everybody to have a proper career choice. There's no doubt about it. So before you enter into the medical college or the medical field, you have to assess yourself what you want, what is your style, what makes you happy or comfortable. In all the subjects and in all the profession, you see the lawyers, they work so hard. The professionals like chartered accountants and all the professions, software, this thing, everybody works
It's
hard.
not easy for anyone.
Not easy for this. You have to see what is, even if you look at the film world, do you think, they also have long hours, isn't it? So hard work, anybody who works hard will get success in life. Whatever, but suppose you decide that you don't want to reach to a level of success and you just want to, it's fine with that. You have your holidays, you have fun, you have less demanding jobs and professions. So the choice is, but the choice should be made at a young age. Not after entering into this and then decide. Even if you enter and you feel that it's not, you can leave the medical college and take up another profession.
Right.
Rather
never too
than
late.
struggling throughout life. And it's never too late. Even if you have done MBBS, MS, and if you don't like the working, I would strongly suggest that give it up, get into some administrative services, some competitive services, or start your business. I mean, nobody holds you back. Education will remain with you throughout.
So let's come back to your journey. So you received Padma Shri award from the president. Sir, tell us how you got that. मतलब कोई भी young surgeon जो देख रहा है उसको कैसे मिलेगा पद्म श्री?
I know, but I think Padma Shri is one of the award, the national recognition. So possibly we were at a good point when we pioneered the technique, and the government was convinced that this technique has been pioneered by some person, So that is one. But Padma Shri or any recognition and award should come by way of your work, not by way of your political connects, no way by work by psychophancy, Those are all shortcuts. It doesn't last long, And that should not be your aim. At the same time, that should not be something after which you stop working. So today we are talking in 2025. I got Padma Shri in 2002. So it's not that I have stopped working. It's not that I have not. After that, I have written so many textbooks, so many articles, so many presentations.
World records. You have world records for
yeah.
robotic also.
Yeah. So we could create world record in 22, 2 world records for robotic surgery, the highest number of robotic
And you are still
surgery.
publishing, making guidelines.
Yes. So it continues. So those are, I would say, just a stopover, just to look back, enjoy that moment of your recognition, and then you move on. You don't stop there.
Sir, I think there are 2 type of recognition. One you get from your peers. Like you said, you were the keynote delivery person. You were the chairman of the Congress. And one is the public recognition like Padma Shri. Sir, when did you, or do you still remember the moment you got your first public recognition?
I would say the public recognition, before public recognition, I got recognized by the peers, our own profession. So when I used to operate and do a laparoscopy, and the couple of senior professors are there, and they see, because everybody knows what's happening on the screen, So at least laparoscopy has got, you can call it advantage or disadvantage. Everybody knows how well you are operating.
Ah.
It's not hidden. You know,
Absolutely.
the whole team knows whether it's good, bad, bleeding, handling well, not handling,
Right.
delicate tissue handling, rough tissue handling. Everything is known to everybody. So I feel that laparoscopy, in a way, differentiated from excellent surgeons to the average surgeon, because everything
it's
is
so
known.
transparent. Yes.
It's a transparent sort of thing. So some of the surgeons who had good hand-eye recognition and skills, and I wouldn't say that it's a skill, which somebody will have that skill and somebody will not have that skill. You know, same thing like singing. Somebody can sing well. Somebody, in spite of training for years and years, may not be able to sing well. So it's like that. So I think we have to keep that in mind. So I would say that I got recognition from our peers much before the public this thing. Of course, our patients were happy and appreciating that they had very little pain and discomfort. So that was one. But I would say then when I operated President K.R. Narayanan for his gallbladder surgery way back, almost 25 years back. So I would say that is the time, because it was very widely covered by media, the television, newspapers, national, international. So I would say that may be the first time the country and the subcontinent knew. And after that, we had the opportunity and honor of operating the royal families, operating the Bollywood, and things like that.
And sir, I think you have a very close relationship with Dalai Lama as well.
Yeah, but I think the worldwide recognition came when I operated His Holiness Dalai Lama in 2008, because it was he was not president of anywhere. He was a national, not the Indian recognition only. He had the worldwide recognition, and I would say that even now he's recognized as a person above all the presidents, because the presidentship is only for 5 years, 4 years, But he has been holding this. In 1989, he got the Nobel Prize for Peace in the world, which is the ultimate recognition in the world, way back.
89.
89.
I was born in 89.
Yeah. So it's very interesting. So those things brought, I would say, our recognition, and also, interestingly, when I operated His Excellency K.R. Narayan Saab, that is the time when the reverse thing started. Before that, everybody who needed surgery were going out of India. So that stopped that trend at that time. And, they started getting operated in India by Indian surgeons in Indian hospitals, I would say.
Sir, operating on a VVIP, like you said, is very different than operating on a normal patient. Did you feel the pressure? Did you feel the jitters?
In a sense, I did not feel any jitter, because right from day one, we have always maintained that every patient on the table or every patient who comes to you is needs maximum attention. The difference, I would say, is that when you are operating the President of India, you have to follow the Blue Book protocols, operating, because he's number one citizen and he is Chief of Armed Forces. The armed forces are with him. So operating that is a different as a protocol, as the formalities. Say, for example, if you have operated the President, you're not supposed to do any operation after that, so that you can concentrate on his well-being,
Okay.
on that particular day.
Makes sense.
And you possibly you cannot tell the President that you will be operating him at 8 o'clock. You're supposed to request him, sir, when you would like to get operated, So these are all small little things. But on the table, I think for us, all the patient on the table is the same. The only thing, maybe we spend a little more time preparing, talking to them, discussing with their families, and following the protocols. Surgically, it remains the same.
It's the same.
Yeah.
Post-op rehab, everything.
Everything remains the same. And it's our very strict protocol that we don't change with the stature of the person. We don't get carried away.
Sir, when did you first feel that, okay, I have achieved success now? I am among the topmost and I have reached the point where I wanted to be.
Honestly, that doesn't come ever. Yeah.
Not yet.
Not yet. Because you are learning, na? So
Achha.
when somebody asks you when you will stop operating, I said, I'm learning every day. I mean, I'm better today than yesterday. So I feel that I'm progressing and I'm able to acquire even further skills. So that way I feel that there is no end to it. Yeah, and it's not ambition, it's not greed, but it's your approach in excelling, in trying to do better today than yesterday. As a surgeon, you should be safer today than you were yesterday, and you should be even more safe tomorrow than what you are today.
Yes, sir. Every day you should learn something. And sir, अगर हम बात करें, did you have any doubts in your career, moments of despair? You felt like अब नहीं हो सकता. Like how did you cope up with those moments when you had the downs?
I would say that the downs were for lack of time. There's so many things to do back to back, you have to operate, you have to see the patients. So I don't think I ever looked things negatively, but the lack of time, and that lack of time also taught me how to utilize and my time and how to have the best time management, for your family, for your children, for your grandchildren, for your team, for your colleagues. So a good time management, I think you can do wonders.
Sir, during your journey, how did you choose Delhi? Because as we discussed before, you are a resident from Jabalpur. You come from Jabalpur,
Yeah,
right?
yeah.
Then, sir, how did Delhi happen?
That's very interesting. My senior colleague gave me a small cuttings from the newspaper saying that there is a registrar's post available at Holy Family Hospital, and there was an interview at a particular time.
Which year are we
It was
talking about?
77.
Okay.
So I took a train and came for that interview, and I was lucky and fortunate that I got selected for that interview, and that's how I started my journey. And then I was picked up from a very senior surgeon from RML Hospital, and then Gangaram Hospital, and then in 2009 we moved to Max Healthcare, Saket. So we still continue to be there, and our institute and our colleagues and my team is with me for almost 35 years and more than 35 years. So all of us, we are together as a team.
Sir, I have heard this one thing about your team, that your team is not the kind of surgeons who get very angry in the surgery room, because I've always heard a lot of surgeons get angry, are egoistic, keep throwing around scissors and forceps which don't work. So,
All those actions denote two things. One thing is lack of your confidence. So when you are less confident, then you do all these sort of things. Second, your ego as a surgeon. Surgeons could be very egoistic, because of that power. But I think that ego lasts the moment anything negative happens on the table. Suddenly you see that the ego,
Vanishes.
is crushed, I would say, because you are the person, you have to handle that situation within fraction of seconds and minutes, So
Right.
that is one. So I feel that our team, you will not find this. All of us, we feel confident about our techniques, our skill sets. We are confident about our team. So we don't get really nervous and start shouting at others. That sometimes denotes your lack of confidence in yourself.
Sir, but you talked about egos of the surgeon. Why do you think it is so famous or infamous that surgeons have big egos, are arrogant, and not for physicians? They don't talk about physicians.
I would
for
say
that.
that's infamous, this thing. And I would say that it is not a good thing to have ego, because it doesn't take much time for the ego to, and ego is the biggest friction in your success. So the more the ego, less you know about the subject. So if you are good at the subject, you will never have ego.
Knowledge humbles you. Yes.
So I think it's inversely proportionate. So a big ego will always, to me, it will denote that your knowledge about the subject, your skill sets, your everything is at a bottom.
Sir, talking about these things, sir, as a resident, there is also a toxic environment usually in surgical residencies. Were you also bullied as a resident, do you think?
No, as a resident, I think the most bullying thing is that you have not done it well. So suppose, for example, if there is a trauma case, you have to apply a plaster, or you have to apply a splint. And if you're not good, you will be sort of scolded,
Reprimanded or
reprimanded. I mean, this is so, because it increases the job. You have to undo that and redo again, for anything. So that, I think that is the only thing. But if you are sincere, if you are working, even if you commit mistakes, your senior colleagues will always say, okay, this was done not as good or as well as expected. And once you know that, next time you modify and improve yourself.
Yes, sir. But also we keep hearing such stories, sir. When for example, the thesis guide makes them do some personal works. I'm sure you must have also heard these stories.
Yeah.
Sir, what about that culture?
But that itself is wrong culture. No? We have to condemn that culture, and that culture develops because of the weaknesses, and that is how those teachers will never be respected.
After
Teachers,
passing
after
out.
once you are
Yes,
out,
yes, definitely.
you will never respect that person, But that happens. Why with teacher? I think it happens with everybody in any walk of your life. If anybody gets things done from you by virtue of pressure or sort of blackmailing sort of thing, then you may do it at that time, but you will not have any respect for that person, But I think it's true in day-to-day life as well, in the social life also.
The bullying happens. Yes. Sir, tell us some quirks or interesting things about your teachers. Do you remember?
Yeah, I think my professor of surgery, Professor O.P. Mishra at Jabalpur, I think he was a great disciplined guy, like he's absolutely disciplined. And those days, we had nothing else but a clinical examination. And he was very strict and very protocol based. For example, if you have to put in a rice tube, so you have to put in a rice tube and inject air, and your stethoscope should be in the abdomen to listen that gurgling sound. Means that it has reached to the stomach. It's as simple as that. And he was very particular. Like if you have putting a rice tube, you have to hear that gurgling sound, so that it's not the esophagus, it's not in the duodenum, it's like that. So that is one. Like he used to tell us how to dress. So the dressing has to start from a thinner portion to a thicker portion. So you have to just spirally go up. It's like that. And then he will be very particular that 3/4 of the width of the dressing should be covered 1/4 should be left.
Left with every turn.
Every turn.
Right,
That's how you
right.
climb up.
Ah.
You don't climb up and down. Otherwise, it will slip.
Yes, exactly.
So I think we owe whatever we are to our teachers like that. And he was very particular about times. So in the sense that, if you are even 5 minutes late, the register used to go under the lock and key. So you can't sign after that. So that was a big thing. Today, those things are may not be feasible. But I think nobody really checks. But otherwise, what used to happen that at 8 o'clock, you have to come before 8. If you come after 8, it's already logged. So you are marked absent on that day. And it's not only absent, but you will be asked why you were late. So we were given 30 minutes to shave, have bath, and change into fresh clothes, and then come. So there was no off days, I would say, 24/7, and there was no time. So that taught us a lot of discipline, I would say. And that continued throughout your life in modified manner also, but it is deep in this thing. Clinical examination used to be, bimanually palpable or bellotable. Now we don't listen those words.
Right, sir.
But those days, any
I remember.
abdominal lump, you should know whether it is bellotable, bimanually palpable, moves with respiration, moves with breathing or
Right.
not, things like that.
Right, sir.
So
For us, there was this book, S. Das.
As Das, yes.
Yes.
That book was there with us also that time.
Acha, it's that old.
Yeah, it was very old book.
Wow.
Yeah. Belly and Love and this as
right.
Das. This was the combination.
Right, sir. Even for our MBBS times. Sir, nowadays, after MS General Surgery, there is a lot of pressure to do MCH. And the seats are, of course, not as much. Sir, do you think general surgeons as such have a future as well? A good future, I mean.
I would say that general surgeons will have a particular level of working. General surgery is a very interesting and very important part of the surgical career. But if you get an opportunity to get super specialized, well, I would say nothing like it. Because I think the surgery also is becoming more and more telescopic. So even, for example, even orthopedic surgeon will be the hand surgeon, will be for the joint replacement, will be for endoscopic surgeries, things like that. So even I think for surgery, if possible,
People
and
should
if
go for it.
yes, but definitely in the B towns, the general surgeons will have their own. But that's a story only in the metros. But in a B town, you have to be the real general surgeon. Everybody will come to you.
Sir, what is your take on the current marketing practices or the social media for doctors? Should doctors be on social media?
Well, doctors should be on a social media, but I feel that they should be talking more, creating awareness about
Educational.
educational
kind of.
sort of, they should play that role, not for boasting yourself what you are. So generally it happens that a surgeon who is busy or a physician who is busy, you will find that he has got very little time for social media.
How, of course.
So I think social media should be used for possibly training, telling them what is right. So, say simple example, they should tell if you have got abdominal pain, you should get an ultrasound done. So know what is the problem. Just don't think that it is because I ate that thing. That's how you will pick up the diseases much before it creates complication. So that's why this sort of preventive health advices are more important.
Sir, do you remember a case in your career that has impacted your life personally, or was it something worth remembering or something worth sharing?
Well, I think very clearly remember in my earlier days of residency. And it must be about 77, 78 when I was in RML, because there was a lot of surgical work. There are a lot of patients, a lot of high volume surgery. So my senior colleague, I remember Dr. H.P. Garg, who is in Apollo at the moment. He was 1 year senior to me. And then he says, look, you are a very good surgeon, but you don't see your patients after surgery. Okay, so that had a big impact in my mind, and so much so that even now, when whatever it is, I don't leave hospital without seeing the patients who have been operated by me on that day. So I would say one simple thing which had deep impact, and I would say that has really made a whole lot of difference in my career. And you could pick up many times, you could pick up some complications, pick up some serious situations, clinical situations, which maybe your younger surgeons may not be able to pick up. So that habit I maintain till today.
Sir, if, for example, you have had a complication in surgery, which is, how do you tell it to the patient afterwards?
You have to be very honest. As I said, you have to be transparent. You don't hide anything, because those complications are known. For example, I think if you are driving a car and there is a scratch, I think you should tell whoever is, maybe your parents, maybe your son, whatever, okay, there is a problem like that, because it will not go unnoticed. Right. So even if there is a complication and the patient relations, they take it well, I can tell you with full confidence. If you tell them point blank that, okay, look, this has happened, and there was a bleeding at a situation, so we had to give this, and we might have to reoperate him. Right. Most of the families, almost all the families, will take it well. They will feel upset about it, but they will always appreciate your honesty, and they will say, okay, but please see what best you can do for that. And then you say, okay, I'm doing that, and it's not only telling them, but your action should also speak the same thing. Otherwise, the complications people will come to know, and when they come to know, they feel cheated.
That's even worse.
Which is even worse. That's important.
Agreed. Sir, on a lighter note, having a non-medico wife, as ma'am is, did that affect in any way your career?
Well, I feel that it actually enhanced my career and my dedication. I think before that also, when I was doing my registrarship, there was a lot of pressure to get married from the family. But I said, let me sort of dedicate myself for the surgical skills, because you can't have divided time with the family and with this. So when I thought that, okay, it's a reasonable good time, I completed my registrarship, this thing, then I decided to get married. And getting married to a non-medico has come as a big blessing to me, because I could rely on her in taking care of the family, the children, and myself, So when you are exhausted, you are tired, you are disturbed, there is somebody to look after you,
But did she understand that you have to put in like 20 hours of work?
See, understanding is the secret of successful marriage. Right. Whether it is with a medico or with a non-medico.
Sahi baat hai.
So understanding has to be strong. Understanding has to be strong. Without understanding, even if it's a medico or non-medico, it doesn't matter. And also it should be encouraging. We should encourage rather than sort of, so everybody, and it's true for both. It's not that only the wife should encourage you and you should not encourage. It's again, I would say, the two sides of the coin, So the both sides of the coin has to be good. Only you cannot be
Expecting and not
expecting
delivering.
a lot and not giving anything. It has
Right.
to be shared responsibilities and shared problems, shares happiness, share moments of anxiety. So that's how, and you develop that language, provided you keep that in your mind, in the priority.
Sir, tell us about a day in your life.
Well, a typical working day, I would say, it starts little early in the morning, and when you get up, and most of the day, you would like to spend some time on yourself in the gym, maybe do some exercises, and by and large, you start our day maybe after 9 o'clock in the morning, and we keep our operating time in the morning and till afternoon. So up to about 2:30, 3 o'clock, we are operating. And then my day is for appointments, which is from 3 o'clock. There may be 30, 40 appointments which you have to see the patients before operation, after operation, the time in the follow-up. And by 6, 6:30 or 7 o'clock, uh, when you finished with your appointments, you go for rounds as a typical round. So by 8:39, the day is over. So this is a very typical day. Uh, of course, if there are some emergency, then you have to spend time at night also. In odd hours also, you have to be there. And sometimes you are there to help your other colleagues in other specialty, to give them the hand uh, for your area
Of course,
interest.
interdepartmental
Yeah,
coordination.
interdepartmental, multi specialty
Approaches, yes.
situations and conditions. And of course, when you come back, you are with the family. I'm not a big socialite. I prefer to spend that time at home with my family, and that's the quality time. And we spend a lot of time on the dining table. And in the evening, my son plays drums, my daughter plays piano. So we may have a little bit of music, and of course, dinner. And after dinner, we spend quite a bit of time on the dining table, where we exchange notes and what has happened in the day, and what is there in the next couple of days, what events which are going to take what. So I think there's a lot of interaction, and that brings a lot of togetherness at a moment when everybody is relaxed.
And do you work on Sundays also?
No, we don't work, but generally I prefer Saturday, Sunday now not to work, because it needs at least 2 days to unwind
And prepare for the
5
Monday.
days and prepare for the next
Yes,
week.
sir. Ji, sir.
And also that day is used for your academics, your paper writing, your preparation of your lectures, keynote addresses, and plenary sessions. So that time you need total concentration on that subject.
Sir, इतने busy schedule में, do you have time for your hobbies as well?
Yeah, I think at present, I think the very interesting hobby is for us to look at the art, and we have a small time collection of our master's art, which I've been collecting for a very long time, sculptures, masters. That is one, various types of shows which are happening, that thing. But in the past, I think, at a earlier stage, I used to enjoy flying. I had a private pilot license.
Oh, wow.
Yeah. So that was my weekend
Acha.
relaxation.
You would go and fly the
Fly,
planes.
yeah.
Oh, wow, sir.
And in fact, I had the opportunity of flying with Mr. Sanjay Gandhi also in Delhi Flying Club. So I used to spend a lot of time. And then golf. Golf used to be very popular. And mountaineering again was my very favorite. I did diploma from Himalayan Mountaineering Institute with the famous Tenzing Norgay, in Nawang Gongfu. I was there. So those were the days, as you know, at a particular age, with the changing age, things also change.
Hobbies also changed.
Hobbies also change. So we are now more into the creativity and passion about knowing the artists, sculpturists, and the way they think and the way create.
Yes, sir. I can see that in this room. It's filled with paintings and other forms of arts.
And previously, at a young age, like mountaineering was very this thing. We used to go to various ranges and do the mountaineering. So it was a big pastime where you are in a particular mountaineering range
Wow.
for a couple of weeks, with the Sherpas. And then flying, as I said, used to be generally weekend thing, going from uh, Delhi to some smaller places surrounding. Cross country flying also used to be hobby.
Wow.
Golf also, till a very long time I was a golfer, but now, as I said, in the mornings they become little busy, and somehow I'm not able to devote that much time in the course which I should. And that time now I think is more for art and artistic activities.
I think, sir, this is it. Thank you so much for coming to this podcast. I'm sure everybody learned something from this.
Thank you for having me. I enjoyed discussion, and I wish that if anybody wants to be in touch with us, we'll be very happy to help them in and guide them for their future ventures.
That's great, sir. Thank you so much. And guys, if you liked it, if you think you learned something from it, please share, like it, and subscribe for more such content. Thank you.